Interstitial cystitis comes up frequently, and UTIs and all the things. And I've never had a guest. I've been looking, I never could find anybody.
Yeah, it's not something a lot of people niche out into because, frankly, it's a very difficult condition to treat. I'm one of them. I had IZ, so I know.
What is the word interstitial cystitis? So the itis I get, but interstitial is that? What part of the anatomy?
Well,
But
cystitis is bladder, and then interstitial is between the tissues, which is
okay.
kind of interesting because itis describes any kind of inflammation.
Mhm.
So it is inflammation of the tissues between the bladder. I mean,
Okay.
if you look at the definition, interstitial cystitis describes what it is, which is what surprises me when they don't recognize that there's an infectious component to it.
Like bacterial infection, or could it
Absolutely.
be?
Hello, it's Healthy Gut Girl, Kitty Martone, and this is stuff your doctor should know. I'm coming to you live from deep inside your large intestine, and I should actually be in your bladder because that's exactly what we're talking about today. We have a very special guest on, Dr. Mandy, and she has a podcast and she specializes in bladder pain, and something that I have not delved in too much, but I know it's a common ailment, particularly with estrogen dominance, and it's called interstitial cystitis. Say that 5 times fast. Interstitial cystitis. Interstitial cystitis. It's inflammation in the bladder, in the ureter, in the urinary tract, and she specializes in this, and it's very niche, and I think it's extremely necessary. I know so many women that suffer from issues having to do with the bladder and the ureter and urinary tract, etc., etc. So this is a fantastic episode, and I want you to get a pen and a paper and take some notes because she's really good.
So I have an estrogen dominance support group on Facebook, and it's a pretty big group. Had it for 9 years. Interstitial cystitis comes up frequently, and UTIs and all the things. And I've never had a guest, and I've been looking, I never could find anybody. And then I came across your stuff and I was like, yes, please, please come on my show because we really need you.
Yeah, it's not something a lot of people niche out into because, frankly, it's a very difficult condition to treat. And the patients they can often be difficult. I'm one of them. I had IC, so I know, I know exactly what it's like to have it. So yeah, it's probably what it is. It's common, which kind of surprises me that there aren't a whole lot of people niching out into it. But maybe more. I think more and more people are starting to recognize it, so maybe that'll change. But
Yeah. Well, tell us what it is.
well, interestingly, if you look at the definition of IC, it's a little different in Europe. So they actually treat it. Let's say they describe it differently than we do here. So really, it's bladder pain syndrome. Really, we should change the name here, but I haven't yet because the medical community here hasn't. But IC and bladder pain syndrome, they're kind of clumped under the same umbrella. And traditionally, it's been idiopathic, meaning no known cause. That's what they've always said in the medical literature, characterized by bladder pain, urethral pain, pelvic pain. There's a lot of different types of pain that are overlapping with it, but the big ones are bladder, either with or without urination. So sometimes there'll be pain when they urinate, or even just bladder pain not urinating. Urethral pain is very, very common. A burning feeling, and then pelvic pain comes along with it. And so in Europe, and I think here too, we know that there is a viral component to it, which is where the IC diagnosis has split. And so, and you can see on the IC network, they talk a little bit about this, is where there's a virus that causes the Hunter's ulcers, but it's rare. I think maybe 3-5%, maybe 10% of the population has that. I don't have any patients with Hunter's.
Okay.
So everyone else has bladder pain syndrome, yet we get called IC, even though they're trying to change the definition to give the Hunter's people a different recognition than everybody else under the category. So I always say IC/BPS.
Okay.
Kind of clump them together.
What is the word interstitial cystitis? So the itis I get, but interstitial is that? What part of the anatomy?
Well,
I mean, obviously bladder, but
cystitis is bladder, and then interstitial is between the tissues, which is
okay.
kind of interesting because itis describes any kind of inflammation.
Mm-hmm.
So it is inflammation of the tissues between the bladder. I mean,
Okay.
if you look at the definition, interstitial cystitis describes what it is, which is what surprises me when they don't recognize that there's an infectious component to it, because there is.
Okay.
Yeah,
Like bacterial infection, or could it
absolutely.
be? Okay.
Biofilms.
Ah,
Yeah, 100% of my patients have a biofilm infection.
now when you say biofilms, the first thing that comes to mind is parasitic, but can that also be mycotoxins, or what can,
No, these are bacteria, usually E.
Okay.
coli, Enterococcus, Klebsiella, and then every once in a while, some weird bacteria pop up that are not common. But the most commonly seen are E. coli, Enterococcus, Klebsiella, strep, all different kinds of strep. Those are the main ones, and they're usually formed in a biofilm. And honestly, the problem is the testing methodologies have not been up to date, and even the testing that we're using now still has flaws. So we just have problems with testing because, like, traditionally doctors did cultures, but cultures have to grow. But if they're in a biofilm, sometimes they don't grow. So because they're trapped inside their biofilm matrix.
Mm.
So, so now these new next generation sequencing technologies like microgen is better. But even with you look at that, like PCR sometimes doesn't show what's living, can show what's, maybe showing what's dead. So there's just a lot of flaws in the technology. Luckily, I'm actually under the mentorship of Ruth Chris. She's retired. She was an IC practitioner who is now mentoring us. So I'm under her mentorship. And so whenever something comes around, like when I do the urine testing, because I do much more than urine testing because I'm a functional nutrition doctor. So
Mhm.
I don't write scripts. I have a nurse practitioner on my staff that actually helps me write the scripts for my patients, but that's just a small piece of the problem because there's an underlying root cause. And so the infection does need to be addressed, but here's the thing. You can go ahead and throw an antibiotic at anything, but if you don't address the underlying problem, the infections are going to come back.
Mm.
So that's why you
Yeah.
have to combine Western medicine with holistic and naturopathic types of modalities.
Okay. What are some of the common denominators that you see with with women who have IC?
So I'd actually made a little chart, if I can share my screen, because
Yeah,
actually someone asked me
please.
the other day, and I have other charts that are floating around my social media, but this is the newest and latest and greatest. So let me just kind of, if I can share my screen, then I will show you. So I just made this the other day because I'm doing some group coaching with my patients, and this question came up because they wanted to understand how everything kind of ties in. And this is just a small snapshot of a lot of the different common denominators. But the
Wow.
biggest thing is most people who have the pain, they have histamine intolerance. So that burning feeling that they're feeling, that burning, that hot, like it feels like fire, that's usually histamine. Now, there is an oxalate piece to it because oxalates are crystalline and they can also hurt as they pass through the urinary tract. So that's why they're up here on the top left.
Okay.
But I put histamine in the center because I was thinking about, like, what is a common denominator amongst most of my patients? And it is definitely histamine intolerance. And they don't all have your classic histamine intolerance that when we think of histamine, we think of allergies. Because I never had allergies. I can go outside and you can throw pollen at my face and I will not sneeze. So, but it's, because there's histamine receptors throughout the body, all over the body. There's, H1, H2, H4, H3. There's different types of histamine receptors. And some people just have intolerance in certain body parts for whatever reason. So I put that in the center. And then there's lots of, and this is, if you look at this, I mean, it's a web. So you can't actually look at it linearly. It's not linear. In fact, when I get a graphic artist to redo this for me, because this is done by me and I'm not artistic, I'm going to have arrows be bidirectional in a lot of places because a lot of this is bidirectional. It's not just one, it's not like one arrow points in one direction, if that makes sense.
Right, because I see histamine on the left too, so I can imagine that sometimes it's like histamine can cause these things, but then also because of these things, you can have histamine. But ultimately, okay.
Yeah, absolutely. So, I know you mentioned the estrogen dominance. Well, I have it right here up here. Well, that's because estrogen dominance starts the cascade of copper toxicity. And then when you get copper toxic, and we're not talking just overt toxicity, we're talking about a hidden toxicity as well. I have patients who have both. So I have some people who have an actual high copper burden, and I have patients who actually are biounavailable copper. So copper is not being utilized appropriately. And then you have a zinc deficiency because of that, because they are nutrient partners. Well, if you zinc deficiency, you're going to get infections, right? And so it's kind of weird how all that happens. But I do think a lot of my patients have a history of birth control use, many of them for over 20 years.
Yeah.
So there's your estrogen dominance piece. But then we have other issues. We have SNPs, polymorphisms, mutations like CYP1B1, and various others that can predispose you to elevated estrogen progesterone ratio. And here's something a lot of people don't realize. They think, oh, perimenopause means low estrogen. Yeah, you might have low estrogen, but you can still be estrogen dominant in
Amen.
perimenopause,
Yeah.
right? Like just
Yeah.
because you're low estrogen doesn't mean you're not dominant, because it's the ratio with estrogen and progesterone that we care about.
I like how Dr. Carrie Jones had likened it to a perimenopause to a almost empty bottle of ketchup. And it's like, you know, you get to squeeze it and sometimes you get a whole bunch of ketchup and other times it's just like spurts of ketchup. It's like, that's perimenopause.
That is, yeah. And then the progesterone levels plummet as well. And then so you have this high progesterone, high estrogen progesterone ratio. And then this is where the copper, and copper is interesting because copper levels are really high during pregnancy. And that's one of the reasons why a lot of histamine intolerance may go into remission for a lot of people with IC. So a lot of people with IC ask me, well, why am I in remission when I'm pregnant? Because you have copper levels that are actually now increased. Your body increases it, utilizing it because the placenta needs it. And so and then to support the pregnancy, you also need it also for the blood vessels of the baby. And a lot of times that helps. So histamine tolerance can also be due to leaky gut, and diamine oxidase enzyme tends to be dysregulated when someone has leaky gut. So that could be why, pregnancy, it's almost like you have so much copper now that it negates all the leaky gut issues that you've had your whole life. And then they go off and give birth. And then all of a sudden their symptoms come raging back because now you just lost the protection from the placenta with all that diamine oxidase enzyme. So it's interesting. Now, another thing to keep in mind with copper toxicity, patients who give birth multiple babies back to back to back, and they don't deal with their copper issues or their imbalances, their mineral imbalances, are likely to pass it on to their wonderful children. And I did with my daughter. My daughter was copper toxic because of me.
Wow.
I gave it to her. Yeah. And looking back now, I know why she had such extreme anxiety as a young child. Extreme. And I couldn't figure out what it was. I finally ran an HTMA on her, and my goodness, her copper levels were off the charts.
Oh, wow.
And I addressed it, and within just 6 months, I saw a new kid. I had a new kid.
Wow.
Yeah.
And briefly, can you share with us what kind of protocol that would be as far as dealing with copper toxicity?
So I always have to find out what's going on. So you have to do the right testing for her because she's young. It's so young people adapt really quickly to interventions. Older people have to do a lot more work. I customize minerals for all my patients. I make a powder. And so based on like what their test says, she started increasing her protein in her diet. We try to cut back on a lot of the processed foods. Chocolate is a really high source of copper. So we were like making sure she's not eating too many sweets. And then I started giving her this mineral supplement. That's what really changed everything, because she needed magnesium badly. So between the magnesium, the potassium, sodium, and all the different antioxidants that were in her, I call it Vicon because that's the name of the company that I use to compound. I started noticing improvements in her behavior, and primarily like the behavior of anxiety. She was having like phobias and fears of just inappropriate stuff. And I just started seeing a more relaxed child and more energies. That's two other things that I saw with her, is she was really fatigued all the time. She never had energy. So I think the minerals helped her, but also she was iron deficient. So a lot of anemias can be attributed to copper as well. So we corrected her anemia.
Do you feel like low iron it's a simple enough fix to just give someone iron, or because I definitely have been sinking myself into this topic for several years now, because I was severely anemic, and then I started and taking iron would actually make me worse. And then I figured out, okay, with the HTMA stuff, about how it's really not about just taking iron, that I had this toxic level of iron and most likely copper, and was needing to actually bring balance to all of that and not just take iron. In fact, iron was the wrong direction entirely for me.
Yeah, iron can actually promote the Fenton reaction. And the Fenton reaction is going to produce a load of oxidative stress in the body. So if you already have SNPs, like some people actually have SNPs for iron absorption, it's important to know your genetics, because I know like if you have like even like one copy of the hemochromatosis gene or any of the other supporting genes in iron absorption, then you could actually be absorbing iron and not even realize you are. And if you do have too much free iron, that's the key. It's the free iron that's in the body. It can actually be very damaging to your internal organs, especially the liver, the heart, and the kidneys, and the brain. So my
Wow.
husband is an iron absorber. This is how I know all this, because he was just having a lot of like inflammation, and I ran some labs on him and realized, okay, you are absorbing your iron. I think a lot of his was because he was taking testosterone injections, and I think that caused him, because testosterone injections can cause iron absorption. Well,
Mm.
his kidney markers, his liver markers, they were bad. I mean, like I was really concerned I was going to lose him, because they were just like getting to the point where they were like, so his inflammation was so high, his CRP, everything. And we started taking some binders to help bind up the iron. And he started doing phlebotomy, giving
Mm.
blood,
Yeah.
the Red Cross. And we got his iron levels, especially his ferritin, because ferritin was like in the mid 200s. We got it down, and I could definitely tell a difference in his just overall well-being.
Yeah.
And
Wow.
his liver markers came down, and so did his kidney markers. All of them they came down.
I mean, it's so complex with the minerals, isn't it? It really, it's like it requires a lot of knowledge, because if you just look at a hair tissue mineral analysis test, and you look at that and you say, oh, this person's low on potassium and low on this and high on this, let's give them that, and it's good. It's more of a puzzle. It's more like you definitely need someone who is proficient at looking at those and understanding what needs to happen with the levels, or you can actually make people worse. Isn't that true?
Yeah, they have to have the training. Like I've done all the training with Kendra Perry, and I also have done a little bit with Rick Malter, but I'm actually going to do his mentorship. And I'm also under Lisa Patel Kila under her mentorship program with the Vicon, and she's a really well-known HTM expert. So I mean, like I'm going to be honest with you, that HTMA test is the hardest test that I have.
Yeah,
It
I
is the
agree.
hardest and more nuanced, most nuanced test. I spend more time studying the HTMA than I do any other test.
I've looked at it a little, probably nothing compared to you, and I don't have that awareness either, and I'm like overwhelmed by it. And so when people say, oh, my HTMA test said that I had this, I'm always like, who told you that? Because let's make sure that it's all, I mean, all labs are really about who's interpreting them, right? Like
Yeah,
there
even
has to
blood
be.
chem. Yeah.
Yeah. So you brought up estrogen dominance. You did, not me. So I'm gonna bring up this question. So in our group, and I'm just freshly in menopause, and though I've never had to deal with IC, I am convinced by some of the studies and some of the work that I've seen recently about in menopause, estrogen does not, it drops out of circulation. It goes low in circulation, but it goes into tissues. Like it's still high in tissues, not in every one, but pretty common. I did this hair tissue not mineral, steroid analysis. And then I
Oh.
did a blood spot, a Dutch dried urine. I did a 24-hour urine. I did a blood serum. So basically I did six labs all in 24 hours. Obviously the steroid analysis was from hair and nails. So that was over the course of 3 months. And the person who I got that test from, he ran the lab, and then he sent me this Chinese study showing that all these women had these extremely high levels of estrogen, of estradiol in their tissues, and they were really low in their blood labs.
Mm-hmm.
And sure enough, I had 100 times more estradiol in my tissues than what's normal. And then we did a bunch of consecutive tests after that with that, as he's trying to gather data. Well, I was thinking about this in terms of UTIs and other areas like the tissues in our bodies, breast tissue, and how as women age, they seem to get issues more so when they get closer into menopause. And so I'm just curious, what's the percentage of patients that you have with IC that are in menopause or perimenopause or post?
Believe it or not, it's pretty equal amongst all age groups.
Really? Would
Yeah.
you say that that's changed over your career, or that it's gotten
Well, they're gonna understand also women who might be a little older, obviously, and not in our age group or anything, obviously I'm not in menopause yet. I'm actually pregnant right now, but I'm in my 40s.
Oh,
So I'm not far. But even with that, I think many of them are not open to trying out alternative medicine. I'm just speaking for people like my mom's age group.
mhm.
They just want to go to their medical doctor and get a script and be done with it. They're not as open. So I think the numbers are skewed because of the fact that the younger people are more likely to seek alternative care, as opposed to
Okay.
someone older is still kind of in that Western medicine mentality. I would have more patients postmenopausal, I think, because I do agree that hormones play a role in the pathology of this because, and this is why, when estrogen levels change, it affects the pH of the vaginal and the bladder. And once the pH is shifted in a more alkaline way, it's less acidic because we don't have as much lactobacilli, because lactobacilli is high when we have hormones, like when we're younger, our lactobacillus levels protect us. And that's why a lot of women postmenopausal are more prone to UTIs. It's because of the pH shifting, because less lactobacilli is available. So I think I would have more menopausal knowing that information. I just don't. I have a pretty even mix of, I even had somebody as young as 19 come to
Wow.
me. Yeah, so I have 19, a lot of in the 20s. I think I have more patients in the 30s than I have 40s and 50s. So again, I think you have to take into consideration, they're probably more likely to seek alternative care. I think the older people may be a little bit more likely to go to the medical doctor. Does that make sense?
Okay. Yeah. Yeah.
Yeah.
Interesting. And then the idea of, okay, so in the group, we have so many women with histamine and histamine issues. And I certainly was one of them. I think I had some SNPs also that made it worse. And also my mom had it and her mom had it. And so by the time I was born, like you said, and she was on the birth control from those days, from the 50s and 60s. So I was born estrogen dominant, copper toxic, all of it. And so when women talk about histamine intolerance in the group, because my sort of area of expertise is gut health. And so I'm always like, let's work on the gut. And I saw that in your diagram there. What are the things, would you say that's something that you have to address on the onset?
On the onset.
Yeah.
Absolutely.
Okay.
Even before I get a lab.
Wow.
Day one.
And what does that mean to you, addressing gut health?
First and foremost, stress is number one. Gut-brain axis. I mean, I tell them, if you have trauma, and I can't work on that, that's not my scope of practice. I'd be working illegally if I try to work on your trauma. You have to find someone. I can make a referral, but you can find someone, but you have to work on the trauma or the stress, or, 80% of my patients have some kind of trauma, whether it's family trauma, marital trauma, abuse, sexual abuse. You'd be surprised how many people I've worked with who've been sexually abused. Pretty scary,
Yeah.
And so that's the first thing, is like that, plus let's get the gut. But if you don't work on the mind, you're not going to be able to fix the gut. Bottom line, you're wasting your time. So with the gut, it's diet first. It's step by step. It all depends on where they're at when they come to me. Let's see where you're at. And I don't want to overwhelm people because they're already overwhelmed.
Yeah.
They're already overwhelmed. And when and I've learned my lesson over the years, if I overwhelm them, they disappear and they don't come back. And I know I did something because I helped overwhelm them. So I have to be very like, where are we? And let's go slowly. Some people are coming to me and they're really advanced and they know everything about nutrition.
Yeah.
I still have to take them from the beginning and say, well, let's see if any of these things have snuck into your diet, because they do sometimes sneak back in.
Yeah.
And the big one is, believe it or not, is alcohol.
Right. Who,
That's
me?
the worst.
Don't yell at me.
Yeah, it's the worst. And it's the one that I think everyone really struggles with, is the alcohol. And sometimes I used to mistakenly think that it's obvious, like alcohol you have IC, you shouldn't be drinking alcohol. Right. And then when I find out they are, I'm kind of like, oh, maybe I need to take this approach differently. Like maybe people do still drink alcohol, because I don't drink alcohol, because I know how bad it is for the gut and it's for so many things. Like you can just have a conversation on just alcohol.
Yeah. Yeah, I remember I saw your post about it and it being a neurotoxin, and also I had a guest on that said that it just one of the first things that it does is it actually permeates the gut, like it actually feeds leaky gut, and that right there is enough to, and being out here in Florida, I have not been drinking, but I'm talking about like the average person and how much alcohol gets into their world. It's shocking.
It's a social necessity, I think. I think people I can't throw a party without serving alcohol. Like my wedding was open bar. I mean, who's going to come to your wedding if it's not open bar? You know what I mean? Like I knew I had to do that.
Yeah.
Because that's what it is. But here's the thing. If you have a chronic illness and you're struggling, everything is sacrifice. I mean, You know, going to college is sacrifice. Starting a business is sacrifice. Getting married and having children is a sacrifice. Well, this is yet another sacrifice. If you're not willing to make any sacrifices, then you can't be upset when your body isn't working and cooperating with you.
Yeah.
I have to have that hard talk with people.
Yeah. And I feel like it's also like, if you had to have a kidney transplant and you had your transplant, you waited, you went through all of the painstaking process of that, and you also were given medication, and the doctor's like, you have to take these medications every day or you will reject the kidney and you will die. You would do it.
Absolutely.
And so I don't know what happens when it comes to nutrition and supplements and
food.
diet changes.
Mhm.
I don't know what happens. It's like we don't think of it that way. So I'm always telling people, try to look at food like 80% nourishment, 80% medicinal.
Mhm.
And like I will lose my kidney and die if I continue to under eat protein, like, all those things that are so important. Yeah, it's a mind game.
And I think that's because you can blame the food industry for that. You can blame the food industry for that because, it's become normal to go, let me go to a school and look what they're giving at birthday parties. It should be like a bowl of fruit and some vegetables, right? Like some, like carrots and celery and dip. And lots of people eat when they come to my house. I mean, that's what I'm serving. You know what I mean? Like healthier. That people know that. But like generally speaking, it's just, I do blame the food industry for that. I mean, this is a cultural problem we're dealing with here because
Yeah.
it's not like that all over the world. It's not like that in other parts of the world.
Right.
Right.
And, I think parenting also, something happened now, probably going off in the weeds here a little bit, but at some point, people stopped being parents to their children and they learned, and I'm sure we could pinpoint all the different types of literature at the time and psychology and all the things that were coming out at the time, teaching parents that it's really a good idea to be friends with your child.
Oh,
And somehow that went a little too far. And now people are not really parenting. And I mean, they are, but there's a large percentage, enough of a percentage that it's making a difference in the way people are able to handle their own lives, where they're making these decisions as if they've never been parented in their lives,
I was watching a TikTok the other day where there was a couple of employers that said they will never hire a millennial ever again because of what you're saying. It's because there's a sense of entitlement that these people are, because of, I think, parenting, and I'm sorry if I'm offending anyone here, because I mean, I'm sure there's a lot of good parents out there who are still doing the right thing, but I do agree. I think there's a lot of sense of entitlement we're creating amongst children. And she was saying how like these people, these millennials that they're hiring, they have no work ethic. They're putting their leg up on the desk. They're showing up late, leaving early. They're complaining all the time. And that might be the mindset that we're dealing with this health issue that you asked a question about, why they're putting their health on the back burner. But yet, if you had a kidney transplant, like that whole question you asked me, I think that's coming from that mindset. They just don't have that sense of desire, the accountability. They're lacking that sense of accountability for themselves.
Yeah. And that's definitely a parenting thing. Thinking about that growing up, I grew up in a military family, and it was like, you work for what you have,
Right.
even in chores in the house. And, when we met children that got allowance, we were like, what?
Yeah.
You get paid to do chores? My parents would never do that. It's like, no, this is your home. You clean it, not because, you just better clean it or you're gonna,
or you're gonna have some problems.
or else. Yeah, exactly. Well, I think with health in general, it's just such a challenge. I mean, even for me, who I've been, brought to this career of mine because of my health issues and learning about, it was only recently that when I went through perimenopause, where I was thinking, I've been doing this for almost 20 years and helping people and teaching people all these different things about gut health and whatnot. And I'm like still doing things wrong. And I realized I needed more attention to detail. I needed a more specific program when it came to exactly what I was taking and the consistency at which I was taking it. Because people take supplements and they're like, oh, I don't feel that. And then they just kind of stop taking it.
Yeah.
There's a bunch of things like that I feel like where we drop the ball as
well, that's because of the medication mindset, though. because when you go to a doctor, you get a drug and you expect and usually do feel something within a matter of days. Think about it. You have a sore throat, and let's say it's strep throat, and they give you penicillin. Well, you're feeling good within 48 hours, right?
Yeah.
This is what they expect. And I still have had to deal with patients who wanted their gut health to be feeling different in a matter of just a month.
Mm.
And if you've been dealing with gut issues for, a decade, you can't expect to come in and take a couple, make a couple changes to your diet and take some probiotics and expect all of a sudden you're going to have a different gut. I mean, I hate to say it, but it took me 3 years to really feel the difference in my health.
Mm-hmm.
Like to really say now I feel like a different person. And even my labs reflected it. My labs took a while to reflect it because labs don't change overnight.
Mm-hmm.
3 years.
Wow.
Because if you're really sick and you have a lot of complex issues, I had mold, I had candida, I had biofilms, I had Lyme, I was on a high oxalate diet, I was under a ton of stress, I was going through a divorce. I mean, there was so much going on in my life, and I knew that I had a problem, but it took me a long time to get out of it. So
Wow.
yeah.
It's the long game.
Mm-hmm.
Right. And, anything worth doing is just worth doing well, sticking to it. And I say this to myself also. So I want to talk about, you probably don't know much about me, but I'm also the CEO of Ona's Natural, which is a plant-based hormone support. They make progesterone, some estrogens, they make DHEA, and they make
Nice. I can
pregnenolone.
look into that. Okay.
Yeah.
Yeah.
And that's how I started my group, because I kept miscarrying. I was having anemic, blood transfusion, like all of it. Meanwhile, still being healthy gut girl, still like teaching gut health. And I had fixed I sound like a lot like you were dealing with a lot of stuff like that. I was dealing with similar issues, but I still couldn't fix the hormonal factor, the hormonal component to it. And so I found progesterone therapy and started doing mega doses of bioidentical progesterone, and it dramatically changed my life. But something interesting that happened was I had a dog at the time, and she was a shepherd wolf, a white shepherd wolf. And when I fixed her, within a couple of days, she started leaking. And forever, for her whole life, she was just a leaker.
When
She
you
would
say
just
fixed her, you spayed her.
spayed her. And so
Okay.
she would get up from sitting down or lying down, and there would be a little bit of pee-pee there. And then as she got older, it got much, much worse. And so when I started studying about progesterone, and I learned that it was the progesterone and estrogen balance that helps the urinaries, and please correct anything I'm saying wrong, the urinary sphincter to be the integrity of it, and that when estrogen rises or doesn't rise, but progesterone declines, that this can cause like weakness. And a lot of women who are estrogen dominant can have incontinence, even young women. I had a few clients who were like in their 20s and early 30s that were leaking when they would run and sneeze and stuff like that. And then, so I was like, you know what? I'm going to use it on my dog. And so at this point, I had already been on progesterone for several months and had seen the dramatic effects. So I put some on her nose and on her missy and a little bit in her ears. And
Is it transdermal progesterone?
Yeah, at that time, it was 3%. It was NatPro. It wasn't Ona's then. And she got much, much worse, like to the point where her whole bed was just peed on. And I knew it was working because that's what happened to me. And we refer to it as estrogen kickback, where like you start to take it and estrogen gets stimulated, and then you overtake that by raising your dose. And so I did that. I consistently raised her dose and kept her on it. She was already like 13. She had been leaking her whole life, and she stopped.
Wow.
Just with the progesterone. I only did it for 10 days as well, but then I kept doing it
Oh,
on
you
her.
took her off of it?
I took her off of it and it was fine. But then she was having seizures. And so that was another thing, because the owner of Ona's, Ona, she had catamenial epilepsy, which is why she started the company to begin with. And she was finding great relief from her seizures using high dose progesterone. So that's why she started the company, so she could have access to it, because her doctors would limit it, limit prescribing it to her. So she's like, I got to make this stuff and make it available to others. So that's her story, but she passed of a congenital heart issue. But anyway, so I started to, I gave it to my dog, and then she was having seizures. So I said, you know what? I noticed she hadn't had as many seizures when she was on it. So I started giving it to her around the full moon, because that's when her seizures would come. I know this is all like,
No, I mean, it makes sense. I think there's a lot of things we don't understand, but I'm sure there's people who've studied the full moon's effect on neurological health. I mean, I think some people do get crazy during full moon.
I don't know.
Animals do.
I
Yeah,
get really
I mean, my
crazy.
dog might do more zoomies during that time, right? I mean,
Yeah.
I mean, I think there's just a lot of stuff. This is why I think all the modalities are so important. Like, don't just go to a doctor. Don't just go to a functional medicine doctor. Don't just go to a nutritionist. Don't just go to acupuncturist. Don't just go, like, you might need a little bit of everybody. Obtain the information that you need, and then maybe people who study that type of effect of the moon and how it affects, and maybe I'm sure there's protocols that revolve around the lunar cycle. I'm sure there are. I'm sure there's
Yeah.
protocols that revolve around the lunar cycles, and some people might be more sensitive to that. You see, it doesn't affect me at all. I don't notice anything, but some people might be more sensitive, just like EMFs. Some people are more sensitive to EMFs if they live near those 5G towers.
Right.
Or the smart meters. Remember back when the smart meters first came out and everybody was like, smart meters, because their bodies didn't know how to handle it. And all these people were having panic attacks because they were getting very neurologically, upregulated.
Right.
So I think there's a lot we don't know, but that's interesting about the progesterone. I haven't heard that. I actually heard the opposite with progesterone, but I think it's only synthetic progesterone that can cause more estrogen dominance because it blocks the progesterone receptors. But that's synthetic.
Yeah.
So I don't know about bioidentical, and I haven't yet. I think a lot of people are still getting synthetic progesterone from their doctors. And a lot of IC patients, they can't handle progesterone. But now I'm wondering if that's why. That's really interesting you told me that, because I have patients who tell me they can't handle progesterone, and then they stop because their bladder reacts to it. But now that you're telling me this, you're saying there's an estrogen dump that occurs, or some kind of estrogen.
Yeah, it's like I guess Dr. Lee wrote a little bit about it, and he was talking about when some women start, they need to start with a loading dose, because he was big on low dose progesterone.
Yeah.
But he said, well, some women can be so severe, especially women that have been on birth control, like I was on for almost 20 years or more. Our estrogen in our tissues is so extreme that when you start to stimulate the estrogen, yeah, it's like an estrogen dump. And then the progesterone at those low doses can apparently, not be good. Like, it can stimulate really, like some women say their fibroids get worse. So we just talk about the two, like, maintenance method of progesterone and the therapy method. And so therapy would be like much higher doses for daily, until you reach that sort of saturation point where the estrogen is not continually kicking back like that.
Is there measurements, or are you just going by symptoms? Like, are there measurements?
Totally symptoms, unfortunately.
Okay.
Yeah. And
I'm
some
gonna
women.
I'm going to bring you on as a guest for me.
Okay.
I'd love to introduce your product line too to my
Yeah.
patients. What was the name of the company again?
Ona's Natural.
How do you spell it?
ONAS. I'll send you the
I'm gonna look that
info.
up. Really cool. So go ahead. What were you saying about the
Yeah, so anyway, a lot of the women who have histamine, we hear it in the group a lot. They'll say, I can't do the progesterone because my histamine gets worse, whether it's
I hear
IC
that a
or
lot.
UTIs. And so we always say, well, if you can, if it's tolerable, definitely surpass that, 100 milligrams at least. Surpass that, because anything under that is just going to drive you crazy. I mean, I went through the most ridiculous kickback phase, and the progesterone therapy website, that's what's, there were no groups talking about this yet. So I was just following that. And she does talk about progesteronetherapy.com. And she does talk, her name is Ray White, and she's since passed. She's older, but she does talk about UTIs and talk about the balance. In fact, I think that's where I learned about needing the balance of both estrogen and progesterone to maintain the integrity of the ureter, bladder. Is that right?
No,
Ureter?
yeah. Well, just that whole part. I mean, it's mainly in the bladder, but yes, it definitely affects all the other parts of the bladder as well. Can I ask you, the progesterone that you sell, or your company sells, ONA sells or offers, is that something that you can dose that way with transdermal at that higher dose?
Yeah, I mean, I find so onus has 3%, 5%, 10%, and 20%.
Oh, wow.
Yeah. And we just had this I just did this small podcast about Ray Peat's patent that actually allowed for people, to the average person, to just make any percentage of progesterone out of your kitchen if you wanted.
Oh,
And
wow.
and he's talking about how, yeah, at higher strengths. And we noticed this too. I've certainly noticed it at higher strengths. It seems like it's much harder to absorb than 3% or 5%.
Got it.
So transdermally, yeah, I mean, I stopped major bleeding. I passed my entire decidual cast. When I started, I was something at like 600 to 800 milligrams at first, just
Mhm.
like every 30 minutes, applying it all over the place. And I was at the end of my tether. No doctor could help me. The next step was a hysterectomy. And yeah, polyps came out. It was shocking. And so, did I answer that question?
Yeah, no. So you're saying basically sounds like the lower dose is better for loading because the the higher concentration of the 20% is not absorbing as well.
Yeah.
So if someone wants to start to load up on the progesterone, they should use what, the 3 or 5%?
Yeah, exactly. I found that younger women, pregnant women, women who are trying to get pregnant in their 20s, even in their late teens, do really good with the 20%. Maybe that's because they have more progesterone receptors at that age. I
Probably.
don't know, maybe.
Yeah.
And so then, yeah, so whereas like someone like myself, or someone like myself who had been estrogen dominant for so long, my absorption was terrible. I was hypothyroid, so my skin wasn't even absorbing. There was all these factors that required tiny amounts throughout the day. And then, we can DIY suppositories. And if people can't get it from their doctors, I always recommend, like, see if your doctor can't help you out first, and if you can't, OTC it.
You mean with a bioidentical? Usually they don't have access, or they don't want to write that. They're usually giving, I mean, unless it's a functional medicine doctor. Usually the traditional doctors are still giving out synthetic progesterone.
Yeah, we see prometrium a lot, but the prometrium, I love prometrium because it helps me sleep. But exactly that's why, is because it's breaking down into allopregnanolone through both passes at the liver. So, you're absorbing 30%. So they're giving you 100 milligrams and you're getting, that little amount. And so it's not going to do anything for PCOS or, fibroids. Like, we need mega doses.
Is that bioidentical?
The prometrium, yeah, it's the
Oh.
little peanut oil capsules that
yeah.
are also crap. They have like dye in them and stuff. And
Oh boy.
I know, but they're starting to make them without the dye, but they still have the peanut oil. But the women have to get what they can get their hands on. It's like, I can't wait until this is a much bigger movement. And all you hear about now is estrogen, which is one of the things I want to talk to you about, which is like, everyone, especially women my age, are just getting forced estrogen.
Hormone therapy.
Yeah.
Yeah, I know. Well, here's the other problem with that. So a lot of patients with IC have hypercoagulation genetics, which increase their risk of blood clotting.
Okay.
So that's another thing, is another finding. I got this one from Ruth, but she's absolutely correct. So the same processes that cause you to create blood clots also can create biofilm infections because of the fibrin. So this fibrinolytic. So you produce fibrin. The biofilms have a lot of, if you look at the structure of a biofilm, it has different components in it. It's got different fibers. It's got extracellular DNA. Some of them do. Some of them have fibrin. Well, the fibrin piece of it is also found in biofilm. So actually, I did a blog on it. I can show you because I have a good picture, that I have a good visual of what I'm talking about. Let me grab that here on my website real quick. So let me find my hypercoagulation blog here. See that? So a blood clot is really a biofilm, like a biofilm.
Oh,
You have these
wow.
little fibers.
Yeah.
So they kind of hold the biofilm. So if you ever Google, I mean, I'm sure people have seen this, but you look Google biofilm, you just go image, you can see.
Oh.
See how it looks? So most UTIs are, most of them, let's go down here. Most of them are like when children get when a teenager gets a UTI and they treat it and it's gone. It's usually planktonic bacteria that's free floating. You can throw an antibiotic at that and wipe it out and then it's gone. The problem
Okay.
becomes when it starts to attach and they start to form these colonies, because now their bacteria communicate with each other via quorum sensing. And now they're
Mm.
kind of trapped, and they're very resistant to antibiotics, and they are very smart because as soon as you give them an antibiotic, they develop antibiotic resistance genes.
Wow.
So some people are more prone to forming biofilms genetically. And so there is an association with various genetics, and the big one is this plasminogen activator inhibitor, PAI. So there's 3 variations of that. This is not a SNP that you would get on a regular nutrigenomic test. You'd have to actually run a specific test through LabCorp to do this one.
Oh, wow.
It's not found in most nutrigenomic testing. So if like you do like, any kind of nutrition genome, you're not gonna get this. You have to go through LabCorp. And there's 3 variations. This is the 5G, which is normal. There's a 4G, which is 1 copy is abnormal. It's the one I have. And then there's the 4G, which is the most severe. So depending on what variation you have, you're at a risk of developing not only blood clots, but you're also at risk of developing biofilms.
Interesting.
And sometimes people do get, endocarditis, they get infections in the heart. And so there may be some genetic predisposition to those. And then there's other things like homocysteine, LP(a), platelets, nitric oxide.
Hold off on stop at the nitric oxide, because, some of the stuff that we're all kind of being exposed to in my group through some of the researchers we really like, doesn't talk about nitric oxide in a good light the way that so many people do. They say that it's an emergency response, that it's not something you want to induce to happen. You don't want to like take a whole bunch of beetroot powder just so you can induce nitric oxide events or whatever. Would you agree with that? Is that what's happening here? Is there some kind of inflammatory thing happening and the nitric oxide comes in to try to do something about it?
Well, there's 3 isoforms of nitric oxide, and the ones we pay most attention to are NOS2 and NOS3. So NOS2 is your inducible nitric oxide. That's the one that you get when you get COVID or you get in a flu. That's you need it in small doses to help clear an infection. But when it becomes overactivated or it's not calmed down, it can activate your platelets. And that's, I think, where a lot of people were getting blood clots when they got COVID.
Ah, interesting.
But
Okay.
it converts to eNOS, which is endothelial nitric oxide, which is the good one, the one that's responsible for circulation. So men who have erectile dysfunction often are deficient in eNOS. They're
Okay.
deficient in that good. And so there are symptoms of eNOS deficiency: brain fog, cold hands and feet are the big ones. Circulation issues, like if someone has like their hands just feel numb or cold, or they just don't feel like they have good circulation, you might be deficient in eNOS. So the key is, if you're taking something to promote nitric oxide, rather than taking nitric oxide, you want to take those things that convert NOS2 to NOS3. And that's done via a compound called BH4.
Okay.
And BH4, tetrahydrobiopterin, I think it's called, BH4. It's found in royal jelly. Royal jelly is a source of BH4, but you need adequate folate to make BH4. So if someone has methylation issues or they have folate deficiency because they're not eating enough folate in their diet, this is where nutrition becomes really important. Then they may be low in NOS3, and that's where the problem lies, is if someone is taking all these NOS precursors and maybe they're pushing the NOS2 pathway and they're not converting it to NOS3, that's when you're going to have problems with all that inflammation.
Interesting.
NOS2. Yeah.
So this is a random question. Is erectile dysfunction, is the same thing happening to women who have no sex drive?
I don't think so. I think with women, it's
I've
more.
just chalked it up to like low thyroid and low testosterone.
I think so. I think it's hormonal. I also think it's neurological. Brain. So a lot of brain inflammation can cause that, because you need the centers of the sex drive are actually in the brain.
Okay.
So no, I don't think it's the same. I think with men, because I've known men who
Not
have
in the brain.
dysfunction, they're still in the mood.
But it's not in the brain for them. I'm joking.
Actually, there is some brain-derived root causes of that with the pineal gland.
Okay.
So some of them may have had damage done to their pineal gland, because the brain does communicate with your genitals. I don't know it, I'm not an erectile dysfunction expert. I don't know, except I do know that men who do have it, they do still have desires. They just can't perform,
express it,
but they
right?
still feel the desires. Whereas women who don't have the desires might be able to perform. So I went through a period
Ah,
of time
got
I
it.
had really low self-drive, really low sex drive when I was really, really sick.
Hmm.
And I could still have an orgasm without a problem if I was sitting.
Right.
But
You
it
just didn't
wasn't,
have the
I
sex
wasn't in the mood.
drive. Yeah.
Yeah, I think it's hormonal.
It's one of my questions on new client forms is like about libido. It says
Yeah.
one of the options is I'm fine once I get started.
Yeah.
Yeah.
Yeah. And there's a lot of psychological stuff behind that as well. Like, what do you do
Yeah.
when you get in the mood? You know, how do you feel about your body? Do you have body image issues? I mean, there's a lot to unpack there with libido.
That's a whole podcast on its own.
Yeah.
Right.
Yeah.
So tell me about the protocol successes with treating IC in your clinic. Like, is it when people commit and they play the long game, what's the success rate there?
Very good.
Nice.
When they commit and play the long game, that's the hard part.
Mm-hmm.
Because I think the easy part is coming in and signing up and paying a sum of money and getting your labs. The hard part is, well, I'm gonna say at the worst case, I literally have had patients who didn't even run their labs. So they had their labs sitting in their house, and I would call, text, whatever I had to do to get them to do it, and they still wouldn't do it. And there's nothing I can do for those people.
Right.
Because, you know, I was listening. Do you know Mel Robbins?
No.
Oh, okay, she's a really, really great. Follow her on Spotify. You're gonna love her.
Okay.
She's a really well-known motivational speaker. I was listening to her podcast yesterday about the relationships with like just healthy relationships with your people.
Mhm.
And she says you can't change people, so don't try to. Like, basically what she was trying to say is people will make changes when they're ready.
Mm.
They're not making changes because of anything you're saying to them. It's because if they think it's your idea, they're not so the statistics are, if they think it's your idea to change, only 3% of people will change. But if they
Wow.
think it's their idea to change, you got the other half of that, the other part of that. So my point with this is, I think sometimes people might sign up to like a health building program, maybe because a spouse wanted them to do it or a family member wanted to do it, but they personally were not ready.
Mhm.
Those people do not get well. They come in, they sign up, they get the labs. Maybe some of them get their labs results, some of them don't because they don't even run the labs, but they're just not ready to make the change and make those sacrifices. Those people who are ready and they take the bull by the horns, you know that phrase.
Yeah.
They take the bull by the horns and they're diving in, they're going through the course material, they're going through all my modules because I kind of run them through modules like they're in school again, and I make them do homework assignments.
Oh, nice.
Yeah, oh yeah, it's much more than just showing up and getting labs and getting supplements and drugs or whatever you need. It's a whole experience, transformative experience. If they do the work and they go through the content and they go through the material and they do the homework and they do the changes and they just stick through it, the other half and the success of that is very high.
Nice. And
Very
so
high.
is that how your clinic works in general? So like if we send you people, they are going to go through that same sort of protocol, like a course.
Yeah, it's a step-by-step. So I send them in modules, kind of, well, they have the course that they can go through and I give them homework assignments because I don't expect them to go through the entire IC healing course because it's too much information. So I
Okay.
send them modules based on I have to get to know them. So if I
Okay.
know someone needs help in understanding what inflammation means, or if someone needs help on their gut, I send them the gut module. If I think somebody needs to understand infections better, I send them infections
Oh,
module, and I give a homework assignment, which is usually like 10 questions.
Uh-huh.
Because I'm also a professor at the college.
Oh, nice.
So I teach biochemistry and biology at the college
Wow.
level. And so I tell my patients, you're going to get a little bit of schooling because I'm also a teacher. And so most likely I'm going to be treating you like you're my students. So I want you to fill out the quiz because if you don't fill out the quiz, I don't know if you did the homework. I don't know if you watched the video. I don't know if you understood it.
Yeah, I think that's so smart. I think it's the future of medicine. It has to be because, it's kind of like, teach a man to fish, right? You give a man a fish, he eats for a day, teach a man a fish and he'll eat for a lifetime. So it's like if someone has a basic understanding of their physiology, of how they make energy or why the thyroid is important or what's up with gut health. Like all of a sudden, when they hear something, they can make a correlation and they can say, oh, Right, LPS. I heard, Dr. Mandy talk about lipopolysaccharides and endotoxin. Yeah, that's me. Like you know what it is? You feel like you're part of the club. You
Yeah.
feel like you're part of the understanding. You're not a child that is being told what to do anymore. You're being given knowledge, and it's like, okay, let's do this together. And you know why you're doing it. Because
But
otherwise,
they have to have the time though to commit, and that's where it gets tricky because it's going to be some work, especially in the beginning when they first start, because the onboarding process is like there's a lot of videos, there's a lot of forms that they have to fill out, there's a lot of like symptoms and surveys, and I have a sulfur survey, I have a copper toxicity survey. I mean, just I want to get to know them better, and then there's videos when they get a lab review. So like if they get their HTMA, there's a residual oxidizer, there's a video on that, and so sometimes people just don't have the time. So that's where my challenge is like, I want to still help people, but then people don't have the time. So I'm still trying to navigate how to do that. Like I'm still struggling with like, okay, I know this is time consuming, but then they don't have the time. But then I also feel like they should be accountable. It's hard. It's really hard.
yeah,
So
I
still
get
trying to,
it.
but those people who have the time, they put the time, and really if they just on the weekend, if they just sat down on a Saturday or a Sunday and spent a couple of hours and just went through everything, it really makes the difference because, and Mel talks about this a lot, there's a part of the brain called the reticular activating system. I'm about to do actually an Instagram video on this that I'll release. When that part of the brain gets turned on, now the subconscious mind has taken over. You don't even realize all the little things you're doing to lead you closer and closer to optimal health, but you have to turn on that reticular activating system, and that's only done when you have a belief. And the belief can only happen if you have knowledge. Without the knowledge, there's no belief. Without the belief, there's no RAS. Without the RAS, there's no healing. You see what I mean?
Wow, that's amazing. That's so
Yeah.
cool.
It's really interesting because that once the RAS gets turned on, you don't even have to try anymore. I want to give you an analogy. Think about one of your friends who might have lost a ton of weight and they look like a completely different person. Maybe they're like even bikini ready. They're like, they look like a bodybuilder. That didn't happen overnight.
No.
And they probably struggled a lot in the beginning, and they probably were working out, eating right, nothing. And then, with women, the weight never moves, right? Like you could go 3 months, you haven't even lost a pound yet. That takes perseverance. But all of a sudden, a year or two goes by and they come and visit you and you're like, what happened to you? Like it almost happened yesterday, but no, it's because they turned on that part of the brain. They believed, they had knowledge, they knew what they needed to do, and they they persevered through the difficult times. And eventually the body starts to do what it needs to do. And that's the same concept.
What is the name of it again? The reticular?
RAS. It's called the RAS, Reticular Activating System. Mel Robbins talks a lot about this on her podcast. It's amazing. I mean, this is the secret behind why people succeed versus those who don't in any venture. It doesn't have to be health. It could be your business. It could be financial. It could be marriage. It could be relationships. It could be academic. Once you turn on that, but you have to have the belief first.
And once it turns on, it's not like it's just always on now. Like if you go through stressful times, if things like you can down-regulate that system probably,
100%.
right?
100%. Some people are just really positive people and they're just really good. My husband's like this. He's just really good at staying focused, even with all the bad things that happen in our lives. Whereas I'm the type of person who falls off the wagon a lot. So I have to always go back to my vision board. I have to go back to, like, I watched The Secret and I read the book, The Secret. So I have to go back and I have all The Secret. I have a podcast that I listen to, the Audible, and I'll have to go back and put my headphones on and listen to The Secret again, because the type of person who will kind of like that person who lost the weight, before you know it, cake is creeping back into their diet. And, then they have to clean that up again and go back to the beginning. So. Yeah,
I think you just described so many people. I certainly am that way. And stress is always my T-bone. It's always the thing that derails me.
Me too.
Yeah, something will happen. And then even if I don't consciously say, okay, I need a drink, or I need to stay and rest and not go to the gym today. Whatever it is, whether I do it subconsciously or consciously, it happens. It's the stress.
It's stress.
And then 2-3 weeks pass and you go, wow, I just fell off my whole program. What the heck happened? So,
Yeah, I've done that with my diet. There have been times where my diet would start, just I feel like I'm losing control. Like, you ever have it where like you're eating when you're not hungry, you're eating late at night, you're just eating and just shoveling food in your mouth. And you know what I do to stop it? I do a water fast. I will just
mm,
stop eating for 3 days and just drink water. And I can tell you, that's another thing that's really nice about water fasting is it just not only cleanses your body, it cleanses your mind because it
mm,
gets rid of all the distractions of food.
mm-hmm.
So there's little tricks like that that people can do to help them stay focused. Like sometimes people, yeah, you're right. Life happens, stress takes over, and you're gonna find over time your thing. Like water fasting is my thing. So if I'm
Yeah.
like really like, I just feel out of control, I'm just putting everything in my mouth and I'm just eating when I'm not hungry and I'm just shoveling food, I'm just gonna stop eating for 3 days.
Yeah.
It does the trick.
Yeah. I'm the opposite. What ends up happening is I stop eating, right?
Oh,
So I need to start eating. Like I need
yeah.
to force myself to eat. But I like that because, but you're right though about like, and then this woman who got bikini ready looks back on her 2 years and she's like, all that work, you see all that work that you've done. And I had the similar experience when I started, switching my whole practice and my whole group and everyone into this pro-metabolic perspective. So it was just like, gut health, which was always my thing, but also like supporting thyroid, supporting detox. And so I started doing it too. And I, was like, I'm going to get off my hormones too. I'm going to get off of progesterone. I'm going to boost metabolism so that I can enter menopause in a healthy,
I
thriving
love that.
way. And so, man, it was hard though. But like you said, I was like, all of these falling off the wagons, getting back on, days of depression, then days of like super motivated. But I just kept on getting back up and saying, okay, it's okay. Stop getting discouraged because you stopped it. And now I look back and I'm like, great. I just had my labs done and I'm not I just started taking oral progesterone again, like a couple of days ago. But prior to that, I'm not on hormones and I'm making hormones. I'm making
Nice.
testosterone. I'm making
Yes.
estrogen. Yeah, not like a 25-year-old, but I don't even think when I was 25, I was making it.
No, my hormones were tanked when I was after I had babies when I was in my 30s. And the ovaries do make a lot of the hormones, but once the ovaries are no longer making them after menopause, your adrenal glands are the ones that have to take up the rest of that. And if your adrenals are not healthy, and that's where a lot of the IC patients have really, really unhealthy adrenal glands, my slow oxidizers
Mm,
especially my really, really slow oxidizers that have like calcium shells. Those are the ones that are probably dealing with hormone problems. And that's what I'm saying. I have a wide range of ages. They're not all postmenopausal. I have girls
right.
in their low 30s that are estrogen deficient. They very low estrogen levels. Yeah.
Amazing.
Yeah.
Wow. Oh my gosh. I feel like I could have you on like 10 more times on different topics.
I'd love
Okay.
to meet with you again. I would love to bring you on my podcast too.
Okay.
Talk about
Happy
hormones.
to. Yeah, let's do it. Well,
Yeah.
I'm so grateful. Where should we send people to be part of? I promise you, people are going to love this concept of the way you work with them. So I want to know where to send them, if at all.
So I see healer and a couple other things. My patients also have a private Facebook group for life. So I don't kick them out after their 6 months. They stay there for life. And
Okay.
then I'm going to start doing group coaching because I'm having a baby. And so
Nice.
I'm shifting things a little bit. So I'm still going to do one-on-one consults, but I'm going to be moving into more of a group coaching model
Okay.
as well. So
When are you due?
in December.
Oh,
Yeah. So I'm still going to be open. I'm just going to go on like a short maternity leave. And then I'm going to have my one-on-one still with the lab reviews and I'm going to have like people can still run their labs and have one-on-ones, but I'm going to shift into more of this group coaching, which I think people actually like group coaching. I think
yeah.
gives more of a sense of community. Seems like that's
I
what
think
you,
it's one of the few things that really came out of the pandemic was people just really got their groove with Zooming and coaching and courses and online community. And I think that was one of the blessings.
yeah. Yeah, no, I think it's a very lonely place to be by yourself and have IC. So that's why I started the private Facebook group. I think I started that 2 years ago. And I think everyone loves it because I'm accessible. I can respond to questions. We have a private chat. You know how Facebook has the chat.
Yeah.
So we have that. And I'm also on Instagram. So if people want to follow me on Instagram, Dr. Mandy DCN is my handle. I'm also on TikTok, Dr. Mandy DCN on TikTok. And I'm not as active on TikTok as I am on Instagram. I don't know, TikTok is weird.
I
And
know.
then and then YouTube is Icy Healer. So I do like my podcasts, and I have a podcast too on Spotify, which is Icy Healer.
Oh, awesome. I'll put that all in the show notes.
Thank you.
And I am so happy to have you here. This was
Yes.
fantastic.
I'll reach out to you and we'll get you on to talk about hormones too.
Okay.
Okay, Dr. Mandy was fantastic. I so appreciate her. I think her information is invaluable. And again, if you go to Instagram and you look her up at Dr. Mandy, DCN, as in Doctor of Clinical Nutrition. And there you can download her free ebook, The Root Cause Investigation. And you can also check out, you can contact her for consult. And of course, you can reach her Icy Healer podcast, which I think I'm going to be on her show pretty soon. Yeah, so check her out. Also, that information is in the show notes. Thank you for joining us. We'll talk to you soon.
Do I know just what I'm getting when it comes